Hello, I'm Ohio Governor Mike DeWine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please, please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor DeWine, and thank you all for joining us today. My name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. Throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. While we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. Ohio is on the road back, averaging less than 50 cases per 100,000 people. Effective June 2nd, Governor DeWine lifted the vast majority of public health orders and most recently on June 18th, the state of emergency was lifted. During this hour, we will address visitation, testing, CDC and CMS guidance, compliance, the Regional Rapid Response Assistance Program, and more. This time is dedicated to you, and we have a panel of experts available to address questions for you. During the session, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. Today, I will be joined by experts in post-acute and long-term care medicine, Doctors Jessica Coleman, Marla Haller, Stuart Cantor, Thomas Lehner, and John Wigan. We also have our featured speakers today, Rebecca Sandholt, Chief of the Bureau of Survey and Certification for the Ohio Department of Health. Again, Dr. Wigan, who serves as our Chief Medical Officer of the Regional Rapid Response Assistance Program, or RAP, which you will hear more about later. I will also be joined by my colleague, Dr. Bruce Vanderhoff, Chief Medical Officer of the Ohio Department of Health. So we will begin discussing visitation. Since March 22, 2021, facilities have operated under the Director's 7th amended order to permit access to Ohio's nursing homes with exceptions. The order was aligned with CMS requirements. However, it was more prescriptive to support safe management of operations, capacity, and flow. Effective June 18th of 2021, that order was rescinded. State regulations on how those visits would occur have ended. For example, visits will no longer require reservations, and residents can have more than 2 visitors at a time. And although the order has been rescinded, it remains incumbent upon you as leaders to ensure sound clinical and safety practices, such as how to manage capacity and flow within the building. But I would also point you to CMS Memo QSO 2039NH, which was revised April 27th of 2021. Clearly states that visitation can be conducted through different means based on a facility structure and residents' needs. Some of those considerations would be location of visits, such as in resident rooms, dedicated visitation spaces, indoor, outdoor, and what visitation looks like for circumstances beyond compassionate care. But regardless of how visits are conducted, there are core principles and best practices that should be integrated in your operations to reduce the risk of COVID-19 transmission. These core principles: screen all who enter the facility for COVID-19, good hand hygiene, utilizing face coverings or masks appropriately, incorporating social distancing of at least 6 feet, posting instructional signage, cleaning and disinfecting high-touch surfaces, having appropriate staff usage of PPE, effectively cohorting residents, and then conducting resident and staff testing. And while we are excited about visitation, as always, we want to be certain that it is facilitated safely. And there are circumstances in which there are limitations. Visitation should be limited in certain scenarios due to the high risk of COVID-19 transmission. And this includes when you have unvaccinated residents, if the nursing home's COVID-19 county positivity rate is greater than 10%. And if less than 70% of residents in the facility are fully vaccinated. And you'll notice from the pie chart what our numbers look like as of June 10th. 871 facilities are in what we call green or low positivity of less than 5%. And we have 82 that are in what we call medium positivity, 5 to 10%. This underscores the need to always know your home status with COVID-19 county positivity and vaccination coverage of residents. Next are residents with confirmed COVID-19 infection, whether vaccinated or unvaccinated, until they have met the criteria to discontinue transmission-based precautions. and also residents in quarantine until they have met the criteria for release from quarantine. Visitation can also be limited when a new case of COVID-19 is identified. And once that new case has been identified, outbreak testing must commence immediately. If the first round of the outbreak testing reveals no evidence of additional COVID-19 cases within other parts of the facility, visitation can resume for residents in areas without COVID-19. But if the first round of outbreak testing reveals evidence of one or more additional cases in other areas of the facility, visitation should be suspended for all residents. As always, facilities should carefully consider all implications for resident physical and mental well-being when determining how to facilitate visitation. And according to the Centers for Disease and Control Prevention, or CDC, they have created guidance specifically for nursing homes. I'll point your attention to the interim infection prevention and control recommendations to prevent SARS-CoV-2 spread in nursing homes. This summarizes the core infection prevention and control practices for nursing homes during the pandemic. And some of the recommendations can be modified in response to the vaccination. And these modifications are regularly updated in the second document, which is known as Updated Healthcare Infection Prevention and Control Recommendations in Response to COVID-19 Vaccination. In addition to staying current as the guidance evolves, it will also be important for you to develop visitation policies consistent with the evolving CDC and CMS guidance. You should also continue to educate residents and visitors about the risks of the spread of COVID-19 and the appropriate safety measures to take to protect themselves. You should also have a good testing strategy in place. And this brings me to the next topic of testing. I'll spend the next few minutes addressing the current CMS requirements, state requirements, and a new self-service tool to assist with ordering tests, reporting results, and requesting vaccine support. CMS Memo QSO 2038NH addresses testing in nursing homes during the public health emergency. Updated on April 27, 2021, the memo outlines 3 testing triggers and how each impacts staff and/or residents. The first is symptomatic testing, where staff and residents with signs or symptoms must be tested immediately. The second is outbreak testing, defined by CMS as a new COVID-19 infection in any staff member or resident within the nursing home. And upon identification of this single new case of COVID, it is expected that all staff and residents will be immediately tested, and they should be retested every 3 to 7 days until no new cases are identified for a period of at least 14 days. And then there's routine testing. And this is testing staff based on community spread, but it's not recommended for residents unless the resident leaves the facility routinely. Now, it's important to keep in mind that the CMS guidance represents the minimum testing expected. The table illustrates both CMS and ODH requirements. And this afternoon, you will hear more from our panel of medical experts about the importance of testing and why, if you notice from the chart, that we support a more frequent cadence at this time than the minimum requirements of CMS. The director's order for the testing of the residents and staff of all nursing homes was updated on May 4th of 2021, and it requires routine testing of all unvaccinated staff at least twice per week. Fully vaccinated staff do not have to be routinely tested, and regardless of vaccination status, staff and residents with symptoms or signs of COVID-19 shall be tested. Likewise, regardless of vaccination status, all staff and residents shall be tested upon identification of a single new case of COVID-19 infection in any staff or resident, and this begins the outbreak testing. And this is a good place to emphasize or to describe exactly what we mean by fully vaccinated. Fully vaccinated, for our purposes discussed today, refers to a person who is equal to or more than 2 weeks following receipt of the second dose in a 2-dose series, or a person who is equal to or more than 2 weeks following receipt of 1 dose of a single-dose vaccine. This is an important point to note, as some staff and residents may be at the midpoint of a 2-dose vaccine, in which case they would not be considered fully vaccinated yet. Now, state support will continue for testing efforts, and while state support has been and remains optional, adhering to the testing requirements set forth within the order and related guidelines are not. Currently, facilities receive some level of support to satisfy the testing requirements. There are considerable facilities that choose among the 4 options that we have. One option being alternating PCR and rapid antigen test. You receive a combination of both PCR and rapid antigen shipped to your facility. The second option is rapid antigen test only, and the third is PCR only, with the final for facilities who opt out of state support. I want to spend a few moments to talk with you about a COVID-19 care center that is scheduled to launch on June 28th. It has self-service functionality that can be easily accessed from our website and consolidated in one place for easy navigation of many functions that you currently use today. It requires one sign-on to access all the functionality. And those facilities with an existing vaccine maintenance login will be able to use that for all the self-service functionality. And for those without an existing login, you will be sent credentials and login instructions next week. Each facility receives one login so that several people in the facility can utilize the portal. Once authenticated, you can make selections to update your facility profile. You can manage your state-supported testing options. You can manage your vaccine maintenance program options. There are also indicators that will alert you to whether or not your profile has been updated within 30 days. And this is an opportunity to update any point of contact changes, staff and resident census, or other pertinent information. The indicators will also confirm if any required reporting has been submitted. And for a quick reference, the opt-in status for testing and the vaccine maintenance program are displayed along with the next vaccine clinic date you have scheduled. Also, with the testing program selections, you can make them at any time through the portal. The capabilities will include aligning testing selections on shared campus settings, selecting and where needed, changing the preferred testing dates, selecting and where needed, changing your program selection. For example, you may want to switch from antigen and PCR to antigen only. You'll also be able to select and where needed, change the lab that you are working with. You can also make selections for the vaccine maintenance program. And again, these can be made at any time through this portal. Once selections are made for either testing support or vaccine support, an email notification with selection details will be sent to the facility point of contact. And in the case of the maintenance program, the pharmacy also will receive notification. So again, after the webinars have completed this week, you will receive a welcome communication from the Department of Aging COVID team introducing you to the portal. You will also receive a user guide document, directions and instructions on how to validate your credentials, confirm the accuracy of your baseline profile, and how to contact us for assistance. And finally, just a note on the vaccine maintenance program. We have received considerable participation. As of today, 1,569 licensed facilities have opted into the program. And for the 177 that have opted out of the program, they have reported to us and indicated to us how they are receiving vaccine from an alternative source. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor DeWine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor DeWine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely: physical health and emotional well being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So, while cases and deaths have declined sharply this year, there is still a risk. So, please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines. Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even uh, our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B117 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day, will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and have stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19, when we look back at the data both in Ohio and across the state, are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC, and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans, or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So, thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so, therefore, uh, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So, thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
I'm happy to be here and for this opportunity to provide information to our nursing home providers. With the state of Ohio opening back up, we must remain vigilant in our infection control practices. We should use reputable sources of information to continue to frame facility policies and procedures. Even with the state of Ohio public health orders being lifted, we must remember that the federal requirements related to COVID are still in place. This includes the quality, safety, and oversight memos released by CMS. There are a few that I would like to discuss with you all from a compliance and accountability standpoint. The first one being QSO 20-39, Nursing Home Visitation COVID-19. With the increase in vaccine availability, CMS, in conjunction with CDC, updated visitation guidance. This doesn't mean that there isn't still an emphasis on the importance of maintaining infection control practices. Facilities should allow indoor visitation at all times and for all residents, regardless of vaccination status, except for a few circumstances when visitation should be limited due to a high risk of COVID transmission. However, outdoor visitation can occur at any time. If a resident is fully vaccinated, they can choose to have close contact with their visitation while wearing a well-fitted mask. Remember, compassionate care visits should occur at all times, even for residents on transmission-based precautions. Surveyors will continue to look at visitation logs to ensure this memo is being followed. Federal and state surveyors are not required to be vaccinated and must be permitted entry into the facilities unless they exhibit signs or symptoms of COVID-19. Surveyors should also adhere to the core principles of COVID-19 infection prevention and adhere to any COVID-19 infection prevention and requirements. It's so important for our population within nursing homes to have a connection with their family and friends, and visitation is most definitely a way to do that. The next memo I would like to talk to you about is QSO 21-19. This is the newest QSO memo to come out in regards to the interim final rule COVID-19 vaccine immunization requirements for residents and staff. On May 11th, 2021, CMS published an interim final rule with comment period. This rule establishes long-term care facility vaccine immunization requirements for residents and staff. This includes new requirements for educating residents or resident representatives and staff regarding the benefits and potential side effects associated with the COVID-19 vaccine, as well as offering the vaccine to residents and staff. Furthermore, long-term care facilities must report COVID-19 vaccine and therapeutic treatments information to the Centers for Disease Control and Prevention, the National Healthcare Safety Network, NHSN. From a survey perspective, the infection control pathway that includes the information surveyors will be reviewing to determine compliance with this new tag will be posted to CMS's website, most likely after June 18th. educating residents and staff on the benefits of risk and potential side effects associated with the vaccine, offering the COVID vaccine to residents and staff as appropriate and when available, and reporting the COVID-19 vaccine status of residents and staff to NHSN will be some of the things that the surveyors could be looking for. Remember, documentation is key, showing that educational materials were provided, that there were sign-in sheets if you had a large staff presentation. Medical records show education was provided, vaccination status or refusal of the vaccine are well documented on both the staff as well as your residents. The next QSO memo that I would like to speak to you about is QSO 20-29. This is the interim final rule updating requirements for notification of confirmed and suspected COVID-19 cases among residents and staff in nursing homes. CMS is requiring nursing homes to report COVID-19 facility data to CDC and to residents, their representatives, and families of the residents. Two key components: reporting to CDC and the reporting to residents, their representatives, and families. The focused infection control survey is still in place. We are able to do a standalone as part of the annual survey. So we will be looking to see if that notification to family as well as the residents has occurred. Additional information related to the notification to CDC and families residents have been incorporated into this focused infection control survey, along with the requirements around the education and offering of vaccines. As I said at the beginning, these are just a few of the memos I wanted to highlight, but all are equally important. Please go to CMS's website, review the QSO memos, and make sure that you're implementing the requirements that are there, as well as the recommendations. I would like to note that we are seeing a slight increase in our focused infection control surveys. We are provided those surveys from CMS that we need to do. That's why it's so important to remember to get back to the basics, remind staff of proper hand hygiene, the importance of social distancing and wearing proper PPE when needed. Remind staff, even if COVID-19 isn't in the building, they need to be diligent on the donning and doffing of PPE. Surveyors will be looking for these things. I'd also like to remind everyone that the enhanced enforcement for any F880 citations, whether it's on a focused infection control survey or from an annual survey, will still require a directed plan of correction. Those have not been lifted from CMS, and we are not expecting those to be lifted anytime soon. Thank you for the opportunity to speak today to all of you regarding nursing home compliance and accountability. We are always available for assistance or questions if you have them. Thank you.
It's a privilege to address you, the staff, who are committed to the seniors who depend on Ohio's nursing facilities. As a physician who has cared for patients just like those who have benefited from the services you provide, I cannot put into words the appreciation I have for what you do every day. It has been an extraordinary 15 months since the beginning of the COVID-19 pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who became ill with COVID and reached out to me for advice and medication. I've had family members who worried that I might bring the virus home to them. I've worn the masks and face shields and gowns and used hand sanitizer. I performed nasal swabs on other people and myself for over a year. So now that we're passing into this next phase of the pandemic, I'm excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar. It will be similar, but it won't be the same. So yesterday I went to the grocery store and I actually could have bought as much toilet paper as I would have wanted to have. I saw Clorox and Purell on the shelves. I can now visit my 85-year-old in-laws because we're all vaccinated. I can go to church or a concert or a Cleveland Indians game. Over the past year, I've learned so much about appreciating little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year. I've learned that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I've learned that over the course of the day, when I ask people how they're doing, and they pause and they look out kind of at the horizon and respond, "Oh, I'm fine," that fine means feelings inside not expressed. So we're now entering this new phase of the COVID-19 pandemic. And in fact, I've heard people say over this past weekend that they thought the pandemic was over. There are very few statements that I can say with certainty as a physician, and one of them is that the pandemic is not over. COVID is still in our communities. It still is among us. And until the entire world can have the opportunity to be vaccinated, like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it will seem like that threat has passed. We are unwinding the requirements and policies that the nursing facilities have been living with over the past 12 plus months. We will eventually be told that this is no longer an emergency. Nonetheless, the same virus that has disproportionately taken a toll on you, your peers, and the population we care for remains in our communities and among us. So we now have at our disposal an abundance of safe and extremely effective vaccines. And if widely accepted globally, this would end the pandemic. In the meantime, the virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is not quite so perfect. It's just a little different than its parent. It's a variant. Eventually, one of these variants will be just different enough that the vaccines will not be as effective. And we could slip back into the outbreaks like we experienced last fall. We can prevent this from happening through vaccination and continuing to practice all the tried and true methods of infection prevention, like hand washing and hygiene, wearing masks, especially around the vulnerable population, including the unvaccinated, and cleaning up after ourselves through sanitization of hard surfaces. Each of you will need to decide to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health or Governor DeWine or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're told that we don't have to. This now becomes our responsibility. It's kind of like school. We have made it through the elementary school portion of the pandemic where everything is laid out for us and we just have to follow the directions. We're now entering college, where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization over these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests, PCR testing, and vaccinations against COVID-19. If you go back to the metaphor about us entering the college phase of the pandemic, think of the RAP program as that guidance counselor that was always there to get you through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering your questions in just a few minutes. These medical directors want to help you and your team, including your medical director, when questions arise about testing or management of COVID outbreaks or just COVID in general. We have contracted with an organization of content experts in infection prevention who is available to you and your organization for COVID prevention and control, for testing strategies, and to provide another voice to educate about the value and importance of vaccination acceptance. In medicine, we call this a curbside consult or a second opinion, and this is available to your organization at no cost to you. RAP has a call center that is open and available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to RAP for assistance. We also have been making outreach calls to facilities who are identified by the Ohio Department of Health as having experienced COVID outbreaks to introduce the program and to verify the accuracy of that information provided by the Ohio Department of Health, by local health departments. If you get a call from the RAP program, please accept it so that we can provide this valuable service and support you. The most important aspect of RAP is that it is at no cost to you, and it can save you time. Let you continue to concentrate on the services that you want to provide, and very likely the RAP program could decrease illness and loss of life in the coming months. Thank you. And I'm going to go ahead and have our panel join us. Terrific. And so what we'll do is I'm going to have each of you introduce yourselves. And I'll ask you a question, which you actually I'll ask you all to answer, and Rebecca will give you a free pass on this, unless you want to answer it too. But so the question is, as we enter this new phase that we've just kind of gone through discussing of this pandemic, what do you think are the opportunities and the risks that nursing facilities have over the next several months as we start peeling away these recommendations and requirements? And we'll start with Dr. Lehner. Thanks so much for joining us.
Good morning, everybody, and thanks to the Director McElroy and you, Dr. John, for allowing us to be here today. It's a privilege to speak to everyone. So I'm Tom Lehner, a medical director at a couple of facilities here in the Northeast Ohio area. I'm also the regional medical director for the RAP program for Region 1, which was Northwest Ohio. Having practiced in long-term care for a number of years, we've seen lots of things over the past 15 months that we thought we'd probably never see in our lifetime or in our career for certain. I was at a Board of Health meeting a couple of nights ago, and we had a guest speaker, and they inferred that the pandemic was over. And what are we going to do now? And it occurred to me that as we unwind some of these regulations and change the way we live, especially out in public without masking, and if you're vaccinated and those sorts of things, that it does signal to us that perhaps the pandemic is over And as Dr. Wiegand referenced in his portion of the talk, the pandemic is far from over. The virus is still out there, and it really is an opportunistic virus. It's looking for any way it can to hook up with someone and make a family. Over the last year, we have made tremendous strides, and vaccination is probably one of the largest reasons why we are where we are today. Other things that we sort of take for granted that we do almost mindlessly day in and day out, it's also become second nature to each of us. Hand hygiene, the practice of wearing a mask, and the safe practices that we do in our facilities to keep our most vulnerable patients safe. Those things ought to be second nature to us by now, and yet we can't take them for granted because that's a large part of how we keep each other and our patients safe. Also, the people that oftentimes get forgotten are our families. If we get sick, we often take those things home to our families as well. So practicing hand hygiene in the facilities, thoughtful use of masks, distancing when it's appropriate, cleaning and sanitizing the frequently touched and hard surfaces, handrails, bedside tables, nurses' stations, etc., all reduce the risk for our vulnerable patients, ourselves, and our families to contract the virus. Other things that we need to be more vigilant about, especially since we're going to see patients coming or families coming in to see patients and residents in our buildings or families and friends. Reminding them about safe practices as well, because they don't live in the environment that we live in. So reminding them about hand hygiene, masking, and if they're sick, they should stay home. If they're sick, they ought to consider being tested, and encouraging everyone to get the vaccine. That's our way out of this pandemic. Thank you, John.
Thanks, Tom. Dr. Haller, first of all, I'd like to thank you for your dedication to the RAP program. For those of you who don't know Marla, anytime I've asked her to help me with something, she's stepped up and really been a champion for the program. Can you go ahead and introduce yourself and how you might answer the question?
Sure. So, John, thanks for considering me to be a part of the RAP program. I'm certainly honored and humbled. Director McElroy, thanks for your leadership with ODA and all of our interaction with your teams. I'm certainly humbled to serve all Ohioans because we're all connected with regards to all 8 of us and Dr. Wiegand with being our chief medical officer. And so it provides us all with that opportunity to serve the whole state. So I'm very humbled by that. One of my concerns, of course, are certainly amongst what Dr. Laynard had referenced, but also with regards to outbreaks. And, one way that we can reduce outbreaks is through vaccinations. So, we know that the vaccines have clearly made a difference with preventing the outbreaks in our congregate care settings. Dr. Vanderhoff, also referenced that earlier with regards to vaccinations, squelching, some of the concerns that people have had with regards to getting the vaccines. I certainly was one of the ones who stepped up and got the vaccine, first and foremost, when it was certainly offered to our teams in Southern Ohio. So I know that a lot of the other facilities and our whole team with regards to medical directors have been vaccinated. But, COVID knows no boundaries. And so that's certainly a concern. We in the RAP program have reached out to a lot of nursing facilities and assisted living facilities. And it was interesting because what we found is that with facilities that have less than 45% of their staff being fully vaccinated, that they continue to have outbreaks. Those outbreaks are both in unvaccinated and vaccinated residents and staff. So let me just recap that so that you understand what I'm referencing. If less than 45% of the staff are vaccinated, COVID-19 continues to enter the facilities and affect both vaccinated and unvaccinated residents and staff. Now, with regards to the residents and the staff that are vaccinated, we know that by getting the vaccine, that it reduces symptomatology. And so what we're seeing also in a lot of facilities are for those residents who have had the vaccine, they're showing minimal, if no symptoms. So we know that the vaccine is working. So with that said, I just want to remind everybody that still yet, like Dr. Wiegand had referenced earlier, the threat of COVID-19 is still very real. And we all need to do our part with regards to what we can do to be able to continue to open up and to be able to care for our residents. We know what best practices are. And, the RAP team, I'll just reference our team. We are such a wealth of knowledge, but it's such a wealth of resources for you all. So please reach out to the RAP team from every angle. And, just remember, we want to reduce any outbreaks. Vaccines are vitally important. And also, before I close, I just want to remind you all that your facilities do have a medical director. Get that medical director involved. I know that this afternoon, I'm actually doing 2 virtual vaccine information sessions with a facility. So, even though we're back into facilities in person, we still have this virtual capability. So utilize all your resources and just encourage everyone to get vaccinated.
Thanks, Marla. Dr. Coleman, first of all, I would like to thank you. Dr. Coleman is my go-to person for adult daycare services and senior centers getting testing set up, and we've been able to get that integrated in. Can you introduce yourself and how you'd answer the question about opportunities and risks?
Absolutely. Good morning. And to just reiterate the thanks everyone else has expressed, thank you to Director McElroy and the state for helping us to put this team together and bringing us here today. And thanks to everybody on the call for everything you've done throughout the pandemic. We throw around the word appreciation a lot, and for that reason, I hope it doesn't lose its meaning, but we truly appreciate you and the amazing work you've done. The opportunity that stands out the most to me as we start to sort of shed the pandemic, if you will, is that for community. We've so lost the sense of community that we used to have in our nursing facilities, and it's so refreshing to see that as spring started and the first flowers came up, we started to see the first blooms of group activities and family visits, and that's been so lovely to see. And that's really what we want to protect moving forward as we continue to come out of the pandemic, is that sense of community, not only to protect it, but also to have it grow, not only for our residents and their families, but for our staff members, because that's what brings so much joy to our work, is being part of that family and being part of a community. I think the best way to protect that sense of community is being proactive in finding those asymptomatic cases that are still going to sneak into our buildings. And of course, the best way to do that is through testing. Really, by embracing that continued surveillance testing, it's the best way to usher us into this next pandemic phase. In addition to things like following the core principles of infection prevention, encouraging vaccination, but this is really that one aggressive defense that we have, if you will. At this point, there really seems to be just as many facilities who are embracing the testing from a surveillance perspective as those who find it overly onerous. But I really think it's moving forward, it's going to be an important way for us to continue identifying those asymptomatic cases. And if you look at testing cadence, when did we really see a high spike in our cases? Is when the assisted livings went down to that every other week testing. We were missing so many of those cases that were seeping in. Now, of course, we hope that there are less of those asymptomatic cases as vaccination rates improve, but they're still going to be there. And if we can do anything to protect our blooming community that's coming back to life, it's continued encouragement of testing.
Thank you, Dr. Coleman. And Dr. Cantor, I'll welcome you and thank you for your perspective as a geriatrician. You also have the unenviable task of answering the same question the fourth time. So good luck with that.
Thank you. Good morning. I've been nervously awaiting. I'm in the, to use a baseball reference, I'm in the cleanup position. So my 3 batters have gotten on base already and done an outstanding job. So I'll do my best. I want to thank Director McElroy and John to thank you for the opportunity to be part of the R3AP program and to be part of this webinar. I agree with all the sentiments stated previously by the other medical directors and all of the professionals about where we are in this global pandemic. One of the things I kind of wanted to focus on was this idea of variants. So I was watching the national news this morning, and Dr. Fauci was discussing variants. Dr. Vanderhoof then mentioned variants, and then Dr. Wigan, you mentioned them. So one of the things that the R3AP program found out through our outreaches is that of the 70 facilities that have had outbreaks, none of them were aware of the recommendation for genomic testing of vaccinated patients and or residents who have signs or symptoms of the COVID virus and then subsequently test positive. So we know that vaccination is crucial. And to date, all of the variants that have been identified, the vaccine is effective at treating those variants. But one of the most important things we can do is try to identify any future variants. So the recommendation is that if you have a fully vaccinated resident or employee who develops signs or symptoms of the COVID virus, they should be PCR tested, and they should undergo what is called genomic testing, which means the State Department of Health will do some advanced testing to see what is the specific variant of the virus that they have. The reason that facilities may not have been aware of that is probably multifactorial, and that's part of the reason we want to help change that. So we've increased communication to facilities, and we as the R3AP program want to be able to help facilitate this. So if you are in a facility and you need help with this, please reach out to us, because the more we can continue to identify variants, the more we can continue to make sure that we are not losing ground in the very successful vaccination program.
Thank you, Dr. Cantor. Director, do you want to go ahead and start offering some of the questions that might be being asked in the chat?
Absolutely, absolutely. And I would encourage everyone who's participating today, if you have questions related to the pandemic and ways to help facilitate safe visitation, please enter them in the question box now, and we'll try to make our way through the questions that come in. So the first question, which is I think one I probably can take, and it has to do with the COVID-19 Care Center that was earlier referenced. The question is, will they have to report the testing data into the COVID Care Center? And for those within the nursing facilities right now, we do extract the information from NHSN, and so we would continue to do that. So again, we are going to continue to try to make this as simple as possible. I believe there'll be multiple ways in which to report, but we do intend to continue to track what you already report to NHSN.
Director,
question.
Could I add something there real quick, Director? You know, one of the things that we've recognized in the state of Ohio, actually nationally, is that that there isn't kind of an all-inclusive list of medical directors. And I know that one of the things that the IT team at the Department of Aging has integrated into that portal is a point of contact page, which you can update when you have turnover in those things, those different positions. One of those places that you can fill in is your medical director, and we would really appreciate it if you fill that information in. That'll be uploaded, and it will allow us, Dr. Lehner has been the Ohio Medical Director Association president for the last, it feels like 5 years, but And one of the things that would be easier for us to be able to do is to be able to respond to all the medical directors, especially if there's information that we find would be useful to disseminate to all of them. So thank you, Director.
Absolutely. So do we know the percentage of Ohio nursing home residents that are vaccinated, or are all the long-term care facilities as those are listed in the ODH weekly infection rate list? Assuming that this is a fairly high percentage, shouldn't that give some comfort level that they will be protected against the Delta variant? I guess I would turn over to the panelists, the second part of that question around having comfort, assuming that there's a high vaccination coverage within for the residents.
Yeah, so in some of our outreach calls, and I think we've now gotten up to 74 facilities that we've been able to make contact with and everything. 82% of the residents in that database, in that data group, have been fully vaccinated. Now, obviously, that number continues to go up and down depending on residents moving in and out of facilities, and the wider acceptance of the vaccination maintenance program. We've seen that people are participating in that, and I think that's awesome. I think I'll go ahead and open it up to maybe Dr. Coleman. Can you respond to kind of the last part of that question about, what that affords as far as protection against like the Delta variant?
We're certainly seeing less cases overall, and we're certainly seeing less symptoms overall in residents who are fully vaccinated. What we're not seeing is total eradication, obviously. So when it comes to testing at baseline, the reason we want to continue the testing is because we're not 100% sure of what the Delta variant is going to look like in our older population. And, testing in addition to vaccination are going to be our two strongholds in preventing serious infection and serious spreads moving forward. Now, what we know so far and what we expect is that we will have good coverage with the current vaccines against that Delta variant. But it's not to a level where we really want to lower our guards until we have better data and see what happens moving forward.
Do any of the other panelists want to weigh in on that? What happens when we get to the Omega variant? Hopefully we don't get there.
Well, I mean, I think that viruses are very sneaky organisms, and their sole goal is to continue replication and continue to make their existence continue. So they're always going to be mutating, and the goal is that we try to stay ahead of that, and we try to make sure that our vaccines are currently covering those things. So I think it is yet to be determined, but the more we stick to the principles that Dr. Coleman mentioned, the better chance we have of staying ahead of that Omega variant, if you will.
And one other comment is that the only way to find out where these viruses are and where the variants are is testing. So testing is, something we were hoping to get away from eventually, but I don't think any of us ever see that happening. I think testing is the one way we can identify, as Dr. Cantor said, and stay ahead of that Omega variant. But without that, we don't know who's out there and where they are in terms of viruses.
I wonder if I'm the first person who's brought up Omega variants. Maybe I can patent that. I'm sorry, go ahead.
You must know something we don't.
I don't.
No, seriously, just to tack onto that, like it was mentioned before, in our outreach calls, we found out that a lot of the facilities did not know about genomic testing. And so, here is this opportunity to ask and to go ahead and get that testing at the next level. So, if your facility is testing positive and the lab that you're utilizing is not doing the genomic testing, certainly reach out to us, reach out to the Ohio Department of Health. I mean, they want to know about these variants, because the only way to really have the insight is to know where the variants are and the types of variants that are out there. We know what we know, but we, don't know everything. That's why we test.
And I wanted to give a little more detail on the numbers. So based upon the maintenance program, and there are some qualifiers I want to put on that. As of last week, we were sitting on average at about 77.2% of the residents who were vaccinated and about 45.5% of the staff. Now, keep in mind, this is not an inclusive estimate, nor a reflection of those who have refused the vaccine. The total number of staff and residents reported by the facilities, that number is constantly changing because of the inclusion of new staff members and new residents in the counts. Also, the number of vaccines administered do not include any of the shots provided, perhaps through partnerships or other means outside of the maintenance program. So I want to make sure that I give some context for those numbers, but as of the numbers we had last week, 77.2% for residents and 45.5% for staff. Keeping in mind, there's a wide range across the state. Some facilities have really high numbers and others are working toward raising their numbers. Okay, there is a question. Can unmasked babies visit outdoors with a nursing facility residents? And there's a little more detail to this question. Along with the visit, may unmasked babies be handled by residents of the skilled nursing facility outdoors if the resident wears a mask? I have residents and their families who want to introduce the great-grandchildren to their beloved family member before they pass.
Dr. Lehner, you want to go ahead and take that one?
Sure, I'll give that a crack. Well, the important thing there is that the resident who wants to see their new great-grandson or daughter is masked. I think that's important. We also know that children in general tend to be less susceptible to the virus as opposed to the patients that we care for. So I think as long as the person is asymptomatic, they're not sick, and they're wearing a mask, it's probably safe. Outside.
What about vaccination status of the resident?
Yeah, and thanks for bringing that up. I would have to add to that the resident needs to be vaccinated. Yeah, thanks, John. I forgot about that. So vaccinated, wearing a mask. I think the baby in large part is safe.
So what about the unvaccinated patient? So they can't hold their baby?
My vote would be no. I would say that puts that child and that family at risk. So my vote would be no, but I can be overruled by others on the panel. That would be my position. I tend to err on the side of safety, having had the virus at least once, and I would practice that with my own grandchildren as well. But I'm vaccinated. But I think if the resident is not vaccinated, the risk is higher, and they probably should err on the side of caution.
So Dr. Haller, Cantor, Coleman, what are your thoughts? Any difference to that?
It's really risk mitigation at this point. I agree that the ideal scenario is a vaccinated resident wearing a mask and sitting outside. We live in Ohio, so outside visitations aren't always completely possible, certainly much more possible, and we've come up with many creative ways to make outdoor visitation happen, even in the worst of inclement weather. So there are rare circumstances where that outside visitation can't happen. The mask is easy peasy. I think that the vaccination status needs to be a conversation. And in fact, it could be an enticing reason for that resident to get vaccinated, saying this is to protect you, this is to protect your infant great-grandchild or what have you. But at that point, I would say that it really needs a conversation with the resident and with the family so everybody understands the risk.
Yeah, I would agree with Dr. Coleman. I think it becomes a personal and family decision at that point, weighing the risks and benefits, because the data is just not solid as it relates to infants. We can make, I agree with Dr. Lehner's thought about likelihood of the infant being safe, but to be candid, nobody really knows.
And I'm just going to tack on to that, and I'm going to take a little bit different approach in the sense of I totally agree with what Dr. Lehner, Dr. Coleman, and Dr. Cantor have said with regards to mask and vaccination and risk versus benefits. But one thing that we're forgetting is that our focus has been on COVID-19. But I do just want to remind everybody that we have all these other viruses that are out there, and there are still residents who are getting ill. And I recently personally had a situation where a family member brought their grandson, visited. They did visit outside, but the resident was vaccinated. The child, of course, is young and so not vaccinated. And the other family member who brought, which was the daughter, brought the child. However, the resident was exhibiting other type of symptoms. And so turns out she was actually ill. And the daughter said, had I known that she had any kind of symptoms, she's not so worried about COVID because she is vaccinated and there was no COVID in the building, no outbreak and so forth. They had just had all their testing. However, we have to be vigilant in being reminded that there are other viruses and other illnesses that people can exhibit. So you have to take that into consideration, not just focus on COVID as well.
So I guess what it sounds like to me is that there's a nuanced kind of consideration. So let's say, you're doing these visitations outside, and Rebecca, in comes a surveyor. How are they going to manage that? You were sitting there and not we haven't called you, so I thought you were feeling lonely.
Oh, no, that's okay. Meaning, so I'm sorry, I don't quite understand your question. So
So I guess just, I think one of the concerns, and as we're moving forward, I think, we've had this playbook, and I think facilities have in some ways gotten used to having just these, kind of, these are the rules. And I think the governor said in his presentation that we're transitioning from these orders to guidance. And so I think facilities need to kind of establish this operating procedure of, okay, let's talk to all these different resources, medical directors and everything, to help with some of these really difficult but very real world questions. But there's always this question behind the scenes about, what about being surveyed and, the risk of citations and everything. So how would you just put it into perspective in a general way, that facilities can help decipher some of that angst that they might have?
So I think first I'd like to say that the RAP team has wonderful resources available to facilities. Sometimes we hear that they don't want to ask for assistance on items, infection control, vaccine hesitancy, because they're afraid it's going to be punitive in nature. And I would encourage all of you to reach out and ask those questions and ask for that assistance. Dr. Wygant and his team do not notify us when there's been assistance given. So I think that is a valuable resource for all of you. I also would say that if you are following your policies and procedures, you are complying with the regulations and following the QSO memos, and you've educated and trained your staff, then there shouldn't be worry when a surveyor walks in the door. We are there to ensure that compliance is in place. And I think, sometimes there's that, oh, they're coming in to cite us. But in actuality, we're just coming in to make sure that you're doing everything that you're already doing. The infection control practices, you're following the requirements, the recommendations from CDC, and I don't want it to be a difficult relationship. I want you to look at us as help. I'm going to stop there because my dogs are playing behind me, and I'm sure everyone's going to hear them in a minute. So let me know if you need anything else.
And so to add to that point, and thank you, Rebecca, and thank you, Dr. Wiegand, for leading us into this. I think one of the things that's important is that you do have the CMS framework. And within that framework, what is very clear is that while we have different buildings, you have different physical layouts, different staffing levels, different resources, there are all these variables. But where they all converge and where we have to be focus is whatever we put in place, however you modify your operations in the way that help to mitigate risk, that you still maintain those core principles of infection prevention. And that's really what this comes down to. How can you maintain those things we earlier listed? Making sure that you're still screening, hand hygiene, effectively cohorting residents, properly masking, making sure you have a good testing strategy, all of those things we talked about earlier through the slide presentation. How can you integrate those things within the strategy you put forth to mitigate risk that is very specific to your facility? And that is where you as leaders have to be thoughtful and work together and do exactly what you're doing here today. That is attending informational sessions, keeping current on the guidance, and consulting with medical experts such as the panel you have before you to help you make these really informed decisions. Now, along the way, continue to educate not only your staff and your residents, but also those families. So I'm going to move us to maybe one last question. Yes.
Okay. Just the one thing I would like to add on to that is that the surveyor does walk in the door. My expectation of my staff is that they're complying with your need to screen them. They will wear PPE. They continue to wear face shields, surgical masks, N95s. They're tested. We have, vaccine records for those individuals that have been vaccinated. So I just want you to be assured that expectations of my staff are the same as what your expectations would be for your staff as well.
Absolutely. So I do actually see that we are at time. There are some other questions here in the queue. So what we will attempt to do is to provide responses and try to post responses to those questions or those like questions on our website following this series of webinars. So again, if we weren't able to address your question aloud today, we will still work to address the questions and try to post the responses. Dr. Wiegand, I don't know if you want to end or if there's anything else you want to say from the panel's perspective.
Yeah, I think, we actually took fewer questions during this webinar because the questions that we got into really demonstrate that we're moving into a new phase where you have to take a lot of different considerations into play, and so that is time consuming. We can't answer questions yes and no. We have to look at all the different variables, and you've seen, we have 5 different people here who were doing that in their own minds as we asked a question. And so, we're here to support you, and that's really sincere. We want to support you. So, anything else that the other panel members would like to say? I guess they agree.
With that, well, with that, I want to thank all of you, all of the panelists for being here and the speakers. You've been great to share your expertise and your time. And so we really value that. And for all of you who have joined the webinar as participants, likewise, we value your time and your expertise, and we stand ready to support you. And so with that, we'll conclude the webinar. Thank you and enjoy the rest of your day.